Did you know that on average, it takes 2 to 3 hours for a patient to go through an entire experience with multiple staff in one appointment? Today, we'll be discovering the innovative ideas instead of hours, but actually minutes to get through the patient initial engagement with our innovative solutions that we were able to interview at the last VIVE conference. So stay tuned to listen to these amazing innovators sharing how we can condense the amount of time we have with patient and provider, increasing their satisfaction as well as provider efficiency.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
I have the privilege of interviewing a series of entrepreneurs and executives in the healthcare innovative space at our last VIVE conference. And there's also health coming up in October in Las Vegas. Hope to see you guys there. Definitely come find me. We are recording and interviewing many investors who are supporting this space. And don't miss out on the podcast mixer with all of your podcast producers, hosts, and mingling with our audience. I would love to see you there. Now, this episode, we are featuring two amazing speakers who developed solutions that really truncate amount of time that we have to sort through paperwork to get to the patient's true problem. Dive into these technologies are not just transformational about how individual healthcare management and information is being processed, but also reshaping the broader healthcare landscape by examining their innovative approaches to their specific impact. We can glance into the future of what we can do to cut down all the nuances and streamlined provider workflow and in terms to increase better patient satisfaction. So today, I'm going to introduce you to Vineet Daniel. He is the CEO and co-founder of Simpl Healthcare, a developer of healthcare data management platform intended for providers and patients. Let's hear what he has to say.
Hi, this is Sabrina Runbeck. We're back at VIVE with Vineet Daniels. He is from Simpl. We are interested in hearing his whole mission behind what they're doing in the healthcare space and how are you uniquely solving a problem?
Yeah, so we are very excited about what we are doing at Simpl Healthcare right now. So essentially, if you think about it, providers and patients, the whole experience between them is not efficient at all right now. Like, whenever a patient needs to go to a doctor, they need to schedule an appointment, they actually need to fill out their intake forms, and all of this has to be set up on the back end by the providers. And providers need to then chart their notes, they need to document the notes, they need to actually understand a lot more about the patients, and then they need to go through the process of filing a claim. And from our perspective, that entire time and that entire setup of point A to point B, which is scheduling all the way to filing a claim, is approximately 2 and 3 hours. And this includes at least 3 or 4 people, including billers, including coders. So what we are doing is we are actually building out product lines that allow a provider-patient interaction to be efficient across all of these buckets. So efficient scheduling, efficient note-taking, efficient interoperability, and efficient billing, bringing that time frame from 2 to 3 hours all the way down to 5 to 10 minutes, and it can be done by one person, the provider themselves.
That's great because as a provider myself, most of the time we actually just love to be there and show up, have the patient there and engaging with the patient.
I love that.
and not so much about all the back end. And when people ask us about how much things cost and whatnot, and how do you get things approved, we're like, whoa, okay, so outside our realms. So talk to the right people, and definitely it can be challenging when we have to jump through hoops and getting to the right people in the door, versus you have a process within 5 to 10 minutes, as you're saying, everything is already there, and then click of the finger. And therefore, from a patient perspective, it seems like, oh, okay, you're taking care of me. I don't have to have all these questions still left unanswered. So with that being said, how have you guys been able to go to market and make sure this solution is getting to the right people?
Yeah, that is a great question. So one of our biggest strategies right now is to actually go to provider markets where we are trying to tackle the B2B approach. So we are looking for healthcare organizations that actually have a lot of clinics. And now, as you know, there's a lot of consolidation happening in the clinic market, right? But before I talk about that, just to step back, like we are not going after the hospitals where they're using Epics and they're using Cernas. We are actually going to help providers that actually really need a solution like Simpl, that are trying to start up their own clinic, or that are currently going through a lot of challenges in terms of hiring more providers to their practice, or actually working with nurses within their practice itself. And then within that space, you approximately have 30 to 40,000 clinics that are not using your EHRs like your Epics and your Cernas. So our goal is to work with large healthcare organizations that have actually consolidated and bought out clinics in the space, and all these clinics are using different EMR systems like Jane App, practice management, intake, and we want to go and help them and just standardize the use of EHR across their entire portfolio of clinics itself. And our second way that we are trying to reach out to providers is through different organizations in different communities. So we are actually working with a lot of like very local organizations, and we're working with providers trying to understand like what is the challenge that they have, and we're trying to solve that challenge. And by doing that, it's word of mouth, it's referral. So that's been really great for us.
Right, especially when clinicians wanted to be able to control of how they take care of patients, not
Absolutely.
part of large organization, and then they can have private practices in different capacity. It is difficult to spend so much money on an EHR system and then still keep up with their functionality, and just thinking about the capacity, how many patients they need to see to keep their door open, versus patient would feel like, oh, if I didn't have the ability just to see you, then they'll be going to someone else. So helping that relationship to stay longer is so crucial. Now, if I give you a magic wand,
Yes.
one big thing would disappear no matter what that is to truly help you to move forward with your company. What would you do with it?
Truly help us move forward with well, that's a really great question. One of the things that we actually want to help providers with across is give them one system that is actually able to solve all of their challenges through and through, so they don't have to buy different pieces of software. So in my mind, a magic wand that is going to help our company is just being able to understand all the challenges that providers are actually facing across the US and even internationally, right? Like we've spoken to a lot of providers, we've interviewed hundreds of providers, we're working with quite a few large organizations right now. But that only covers a bit of the challenges, right? And we want to understand like how best and how deeply can we actually solve for all the challenges that providers or even large healthcare companies are actually facing in this healthcare market itself. So if I were to have a magic wand that actually helps our company do better, I would love to deeply understand like any challenges that currently providers or large healthcare organizations that are kind of trying to scale their business are actually facing, and how best Simpl can help them.
So you wanted to focus on how you can be able to be the solution to anything out there to integrate all the components, and then so to you, the way to adapt your system to others is really about the gaps that they are looking at and facing, so you can actually tailor your solution and build it in a way to support them.
Yeah, absolutely. Like we are a very customer-centric organization. Like whenever we work with providers, we have like weekly calls with providers. We have our weekly calls with all of the organizations that we are working with. And the goal for us is that if you make a product that is really good, it's amazing, your customer love it for one customer, there are going to be a lot of other customers like that that are going to want to use the product. And our go-to-market strategy has very specifically been in solve for primary care first, because primary care needs are probably a little lesser, and then start tackling very specific niches like therapy, occupational therapy, speech therapy, and then move into the other verticals.
Amazing. Now, we all love events, and that's why we're at VIVE. So what really is about VIVE that brought you here, and what are you hoping to get out of it?
This is a great question, and one that I was very lucky enough to be partnered with my CTO and co-founder, because I have a lot of experience when it comes to dealing with providers, but my co-founder brings this depth of experience of working with large healthcare organizations. If you take a Best Buy as an example or a Walmart as an example, and the way that we've built out our platform is that you can take any of these unique product lines and use them as APIs, use them as web services. So the goal for us at VIVE is to actually meet with all of these organizations. And as you can see, 20 years ago, healthcare was healthcare. And now it's transitioning and it's becoming into health tech. A lot of providers, a lot of healthcare organizations, they are trying to embrace the use of AI. They're trying to embrace the use of technology to just better the experience, for themselves, for their patients, for their organizations. So my goal at VIVE, along with our goal at VIVE, is actually to make sure we try and meet with as many people as possible that actually need to use a product like Simpl to benefit their organization better.
Awesome. How can people find more about your company or connect with you guys individually?
Yeah, so we are at booth 32439. You can go to simplehealthcare.com. Simple without an E. I have to mention that because a lot of people put the E and then we get, and they find the wrong company. You can find us on LinkedIn. We have our own page. You can send us messages via social media or actually reach out to us via our website, and one of our team members is going to reach back out very soon.
I appreciate you for sharing your story with us.
I really appreciate your time. So thank you so much, Sabrina.
Hey everyone, it's Sabrina here. What did you think about the last conversation I had with Vineet? We talked about really speed up the process of workflow that we have interaction with our patients. Think about the tedious amount of hours that you spend just going through paperwork and making sure all the information is there, from billing, from address collection, contact, all that 9 yards. And now it's no longer a science fiction, it's actually happening right now. So Simpl Health are pioneering a system that is like a swift knife for healthcare providers. And we're talking about scheduling, note-taking, billing, all enrolled into one slick package. So yes, it's saving us time, but also increasing quality because that also means we can cut down the human mistakes in the process. And yes, every single innovation will be able to shake up what we have known to how we needed to practice going forward. So if you're listening and also thinking that you have a story that you can really inspire others, then we wanted to hear from you. Apply to be a speaker on our website, and there is a criteria on how to feature you as a success story. So I will hope that you are able to meet these criteria, and then we can give you that success spotlight. All right, go to theprovidersedge.com to apply. Now let's get back to the second half of our show. Up next is Marc Mar-Yohana. He is the founder and CEO of Otis Health, a personal application and platform focused on patient caregiver engagement and population health and clinical research all embedded in one. Let's hear from Marc. We have Marc here with us. I'm so excited for you to join us at VIVE and share with us what's the true mission behind Otis Health.
Thank you so much for inviting me to be here, and really honored to be able to talk to you about Otis Health and our work and our mission. So Otis Health, its primary purpose is to serve families, caregivers, and people with chronic illness with a better set of tools to manage their everyday health. And it started because of my experience as a caregiver for my daughter Constance, who had autism, apraxia, speech, and epilepsy, and she passed away from an undiagnosed brain tumor. And so even though she had the best care available to her, she had a pediatrician, neurologist, and a therapist that saw her 5 days a week, and also loving parents that were watching over her, we had no idea that had more serious illness. And what we found was that all of us had notes that put together would have told us that she had a more serious illness, but they were spread out on different systems. And as parents, we had no system. So no one had one complete view of what was really going on with her health. And so as her family caregiver, we didn't really have a way to collect our data and share it out with everyone that needed to see it. And even her healthcare providers, of which she had many, they were collecting their notes on different systems, so they weren't able to share with each other. And so the way that Otis Health is designed, specifically we say we serve the family caregiver and also people with chronic illness, because they're the ones that need the tools every day to set medication reminders, to be able to provide notes such as activities of daily living, and be able to securely share that with everyone that needs to see it, including the clinicians like yourself.
Exactly, and that makes everything more convenient. It's in central place without losing the logins, as you were saying. And since this is something that has been a great tool to bringing everything together, what's your main focus on go-to-market and really reaching the end users that need this product? So
first, one thing I like to say is Otis Health is free for anybody to use. We never want to charge the family caregiver for access to their own healthcare information, and we set up the secure platform that's HIPAA accredited. We're nationally accredited by Direct Trust for secure communication with healthcare provider systems, and that's all free to the public. But the way that we actually go to market is with our client partners, so health plans, healthcare providers, life sciences companies, as well as public health institutions. So they can approach Otis Health and ask for white label versions of our platform, branded just for them, to serve a broader community. And so in that way, we can bring on thousands of people that need our help, and those people then can invite their family to join for free.
That's amazing. And what have been one of the biggest wins that you guys have so far?
So so first, it's incredibly amazing that we're getting folks in the market, in the healthcare ecosystems, coming to us and asking for help in the very things that we have been struggling with as caregivers, and like communication with the provider, ways to provide direct access to health information. One of the initiatives that we were asked to participate in is this national initiative with the U.S. Department of Health and Human Services to improve patient access to healthcare data, so that everyone can get the data when they need it and be able to share it. And that even helps the clinicians, because sometimes it takes the clinicians a while to get the data, but in the new framework that we're implementing, the patient can get the access within 10 minutes and then share it with the physicians, which may take the physician's office a couple of weeks to collect that health data. We can literally get it in minutes. And so that's a big win for us. Another is a life science company recently asked us to launch a new caregiver care coordination platform. So it's a care coordination between the physician and the patient's caregiver, and where the caregiver can take assessments on a monthly basis and provide that feedback to the healthcare provider to let them know how the patient is doing.
Yeah, that's so fun. And thanks for coming together fruition for all this. And then I know you guys have been having some amazing wins with a bigger organization, really trying to push this out for everyone. So now, if you think about our audience, are your helpers, and you have a magic wand, what will be one challenge you hope just disappear?
So the biggest challenge that we're working on resolving right now, and that we hope disappears, is this patient access issue. And so the biggest challenge is getting the healthcare providers to hook up to the national networks and the regional networks to share the information openly with other organizations. And so today there are very few healthcare providers that are opting in to these national exchanges or even the regional exchanges. So as a result, it means that as a healthcare provider, I need to know the login credentials for every single place my loved one has their data, and that's an incredible burden on a family caregiver. So we really want, that's our magic. If we have one magic wand to wave, that would be to resolve that one issue of patient access and caregiver access, because that would reduce so many problems we have with visibility to healthcare needs.
Right, it's getting the clinician side involved, because then behind that trust, then they're able to really share with many of their patients and family members to join force.
Absolutely.
Amazing. How can people find more information about you guys or contact you directly if that's preferred?
Yeah, absolutely. They can always reach out to us. Our website is OtisHealth.net. That's OtisHealth.net. And we also are on LinkedIn, Facebook. But just reach out to us on our Contact Us page. Most importantly, you can just go to any of the app stores, Google Play and Apple app, and download our app for free and start using it today.
Thank you so much for being here, Marc, and I hope everyone enjoyed this segment.
Thank you so much, Sabrina. I'm really honored to be here, and I hope to make a big difference in people's lives.
Wow. Okay. We are definitely had an eye-opening session with my conversation with these two amazing founders today about reshaping how we really interact with our patients and our data from these headache, time-consuming tasks. And we're definitely getting somewhere big, something definitely worthwhile of understanding. Now picture this, physicians and nurses are spending less time clicking buttons, charting and documenting, and more time actually talking face-to-face to the patients instead of turning away, documenting. And making things just more personable and easier, less work on scheduling, paperwork, billing, which feel like chores, and more on the fun part of why we get into medicine. And so that really got me excited, as one of the reasons I even love medicine is the back-end administration. It's just constantly never ending. And these texts are not just about making life easier for people in white coats, but it's also truly about the patients, the caregivers, how to walk into a clinician's office, a hospital, and feel like everything is ease and in flow, and no more repeating your whole life story every single visit or waiting for ages for results. And now I'm curious, how do you see this playing out in your daily life and staying healthy or seeking care? I definitely want to hear from you. So let us know how this might change your next encounter if you have these technologies in your hand. And let's keep this conversation going. Hop over on LinkedIn, share your thoughts on this topic, and tag me, Sabrina Runbeck. I would love to hear about your ideas. What sparked your mind, whether you are developing a technology yourself that this can be something enlightening, or can be a collaborative partnership, or can be something that you want to adapt into your own practice. The future of healthcare is super wide out there, make anything possible. And it's really not just about having high-tech gadgets, but what's the experience that we're bringing for all the interaction. So, can't wait to hear about what you think.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.